Welcome to The Bone, the podcast that goes deeper. Here we cut through the noise and get straight to the core of the issues that matter. From real stories to raw truths, we dive deep into the conversations that shape our world and challenge our thinking. We're not afraid to dig in and get to the marrow of it all. Whether it's life, culture, or business in sports medicine, we're here to break it down raw and real. No filters, no fluff, just to the bone. With your host, Shelby Daly, we're getting to the bone. This is a clinically pressed, approved CEU podcast. Find the quiz to gain credit at clinicallypressed.org/courses. Clinically Pressed Company, making the complicated simple through results that give back. Find out more at clinicallypressed.org. Let's get started.
Welcome back to the Bone. Today we're joined by Dr. Stacy Walker, a founding leader of the Association of Athletic Training Education, or AATE, an organization created to strengthen collaboration, innovation, and leadership among athletic training educators. We'll talk about what it takes to build a new professional association, how AATE is redefining its role in our profession, and why educator-led changes is vital for the future of athletic training. So welcome to the show, Stacy. So I always start off, what is your favorite thing about athletic training?
Relationships with the students. It's really fun to watch them grow and evolve over time. But when I was practicing, it was totally different. But yeah, the relationships with the students is really fun, especially now with the master's degree, watching them change and grow from their first to their second year.
Mm-hmm. Yeah, I bet it's a big jump in a short amount of time.
It is, because the way our program works is that it's the first year of our program is highly academic.
Mm-hmm.
Our students do some clinical practice here and there, but they're in clinical education. But we start our immersives this summer, their second summer, and then they're basically in immersives after that, except for 4 weeks when they come back to campus, which is happening right now. So they're in clinical practice quite a bit. So when we watch them leave in May, they're a completely, not completely different, but as a athletic training student, they're a completely different person when we see them in November. So
yeah,
pretty fun.
Cool. So what is the AATE and how is it different from CATE?
Sure. So the AATE is an organization that was built out of wanting to specifically help educators and bring educators together to further themselves as educators, and also to bring the profession forward. And so it's different than CATE because the CATE's role is to oversee accreditation. And so we don't oversee accreditation. And so we are partners with the CATE and have a great relationship with them. But and we have some probably more similar than different things. Like, we both want to drive the profession forward. We want to see educators do well. We want to see students do well and succeed in the profession and everything. But really, their end goal is to provide accreditation to programs. Well, not provide, but I'm going to use the wrong words, but to accredit programs who go through that process. And our goal really is to help educators connect them and drive them and help them develop themselves, and provide support and resources to help them become better as people and as educators.
Okay. How long has the AATE been around, and what prompted for the creation of it?
So we met, the AATE started in 2019. and we were incorporated around that time. We met and formed some of it in 2018. Myself, Sarah Brown, who at that time was at Boston University, Mark Larson, who at that time was at Boston University, and Annie Winterstein, who at that time was at the University of Wisconsin, Madison. And so we got together and thought about what would an organization look like that was solely focused on educators. There are other associations out there that have really broad focus or very narrow focuses, and we wanted to provide an association that would provide a very narrow focus for the educators. And so that was how it started. So we really started in 2019, and we've been going ever since.
Okay. And then was there a specific moment, issue, or a gap that may have sparked why this was needed or needed something new?
Sure. We felt that other healthcare professions there are other healthcare professions like physical therapy, occupational therapy, even medicine, the AAMC, have specific organizations that their role is to provide assistance and resources and development to educators.
Mm-hmm.
And so we really were missing that in athletic training. We obviously have the NATA, and the AATE at that time had meetings every year or so, but there really wasn't anything specific to athletic training, very specific to driving education forward, that wasn't also for other needs of athletic training. And so that was the reason that we decided to talk about this and think about like what might, can we do this? Is it possible? How is it feasible? And do we think that this is something that the profession needed? We felt that, and so we started having these conversations. And really the the history of this is way further back than, and I won't go into huge detail into it, but the history of it is way further back. A couple of different meetings that predate me even being involved, where there were educators that got together for the purposes of thinking about how to drive the profession forward. But the real the tipping point was the four of us getting together and deciding to actually create something. And we spent a couple days at a place in Nantucket and really thought about what could this look like? How could we organize it? How could we structure it? The tagline, not during then, but at our first, we called it a colloquium that we had, became the tagline of Relentlessly Positive. And when we met over Nantucket, one of the things we talked about was we wanted to have an organization that could be fast and nimble, that could change with the times, that wasn't bogged down by policy or too many checks and balances, that if a topic or a need came up in the profession and maybe something needed to be investigated or something was needed to move things forward, we would be able to put together something quickly. Maybe we call them work groups, and that would be something that would be able to happen quickly versus some of the, just by virtue of how things grow and how big they are, sometimes things get so big that it's hard to do things quickly because of process and people involved and everything. And we wanted something that was fast and nimble and relentlessly positive.
Yeah. When putting this together, did you need to get approval from NATA, Katie, or any of these organizations to actually officially form?
No, not really, because it wasn't, we could kind of do whatever we wanted, but we were very strategic. We developed the AATE, and before we said anything public, we reached out to different leaders within the NATA, the Katie. I think we even informed other types of organizations, such as ATPPS, and I can't remember. It's been so long ago. But we were very strategic when we did this to be respectful that this might not be a positive for some other organizations and associations. They might not see this as a good thing. They might see it as competition or as they're not doing enough or just in a negative manner. And we weren't really, that wasn't our goal. Our goal was to create something specifically for educators that was very focused. Yeah. And so, but we did inform presidents. We did reach out to individuals. At that time when we formed, Andy Winterstein was our president, and he had, I believe he had like phone conversations with people. We were, if he didn't have phone conversations, we had emails, and we were pretty strategic. If my memory's right, the educators conference was around the time where we started to go public in 2019, and we were very careful to not do too many things publicly before the right individuals were informed.
When you were putting it together and identifying or talking to all these different organizations, was there actual pushback or any roadblocks along the way that happened?
That's a great question. Yeah, there was. I don't think that the NATA was very happy with us. So I think they saw it as, I'm not sure how they saw it, so I don't want to speculate, but I don't think they were very happy with us. But we just forged forward. We didn't, our whole mantra the whole time has been just to forge forward and be, try to be there for educators, try to bring the profession forward, keep doing and keep it on, and move forward. But yeah, I don't think that there was some controversy when we formed. Yes, but I don't know firsthand what it was, because no one's ever really said anything to me. So I don't want to speculate. I have my thoughts, but I'll keep them to me.
So hypothetically, do you feel that the NATA should have created committees to encompass these specialties, since, all these specialty organizations are booming at this point? Or do you think that there needs to be some distance from the national organization so these communities can actually move forward? Like you had talked about, there's a lot of bureaucracy, there's a lot of checkpoints and checks and balances. Before you guys started, do you think that this should have been created within the NATA, or do you think it was going to naturally branch out like this?
That's a really great question, Shelby. And I'm going to handle it I want to talk about a few things. It's a great question. I'll be brief, but
no, you're good.
I think I want to start out by saying something probably that ends up more at the end, but I think this is a very natural evolution for our profession. I think that no one organization can meet all the needs of all of its stakeholders. And the NATA was, we're a very young profession still. We're 75 years old, right? 1950. I mean, we've been around longer than that, but the NATA was formed in 1950. I kind of see that as like our beginning, even though but we've been around a very short period of time. If you look at other healthcare professions, we've been here a minute. And I think this is a natural evolution. When you start a healthcare profession, like we did in athletic training, we were very streamlined. We worked in colleges, we worked pro sports, and some high school. And if you look at where we work now, my goodness, what a change. Even from when I was in undergrad. I mean, I graduated in 1996. I mean, your options were to go to grad school. That was the biggest thing everybody told you to do. Or you go to grad school to find a job in a college, or you try to find a clinic job, which were few and far between. Anyway, so I think this is a natural evolution of us, the athletic trainers who teach and are part of accredited programs have very different needs than the athletic trainers who provide care to tactical athletes and the military, who have different needs than those in the physician practice setting. And, it is not a bad thing, in my opinion, that these different societies have formed. And, one of them that's been around for a really long time is CATS, the College Athletic Trainers Society, since 1992. And, it's a natural evolution. The NATA has, and this is purely my opinion, but the NATA, to me, is about athletic trainers, period, and looking at the whole picture of us and moving the profession forward, regardless if you work in the high school setting or if you're working for the New York Giants.
Yeah.
And I think that when the NATA started, and even within the last 20 years or so, that was more similar than different. But it has become so different, the where we are and what the needs are of the different individuals in the profession, that I think these societies are a natural evolution of things. And there is no harm in, one of the things that we have never encouraged anyone to do, nor have I done, is not be an NATA member. All of us who founded this are still NATA members. I will never give up my membership until I don't know, I'm old, to die, retire, It's a valuable membership to me. I joined in 1993. I want to support the profession. And so there is, and I understand other people have different views about joining multiple societies, but, it is a wonderful thing for all the educators who are part of the AATE to also be NATA members. We're still athletic trainers and want to support the efforts of the NATA. So, I think there are some things that the NATA was doing and is continuing to do for educators. We wanted to create a group where its sole focus was that. And, the NATA is a large organization, and resources, you've got various committees and various councils and various things going on, and it can be hard to manage what's the priority and who at the NATA office, who's the priorities, and where does a person's time go? And so we just wanted to create a space where that's our focus, that we have a very streamlined focus, and that's what we want to focus on and do that. So I think it's a normal evolution, but I don't know if everyone, I know not everyone will agree with that opinion.
That was a very good explanation, and that's where I think there is some fracturing of the relationship between the National Association and a lot of athletic trainers, because they feel that maybe they're doing too much and they've kind of lost sight of looking out for the individual athletic trainer, which they can't obviously watch out for every single one of us in all of our instantaneous situations. But I think that's where a lot of the divide is coming from, is that we don't a lot of athletic trainers don't understand what is the purpose of NATA, which, I mean, if you think about it, yes, it's the overseeing body of how we're functioning and working together. But since we've boomed in these specialty settings, I think a lot of athletic trainers don't feel supported in where they're going and the new paths that are being driven, because the NATA is watching out for the whole. And I think it's confusing on what they're supposed to be providing for these people that are forging new paths or, in these specialty settings. And I think that's my impression right now, and why it's so hard for people to continuing being a member and paying the fees is that it feels like there's a disconnect, and the NATA hasn't provided a streamlined explanation of what they're providing the athletic trainer. I don't know if that's your interpretation or what you've read into, but I think with these specialty organizations, like you talked about, it is natural, and then people can feel heard at a smaller scale rather than trying to yell in the big room of NATA of what they're needing in these specialty settings.
I completely agree. And the NATA can't be everything to everybody. And the other thing that's happening is, there's just, well, I'll stop there. But I completely agree with everything you said. The NATA, in my opinion, over time has gone to trying to please too many people instead of thinking about, okay, for the athletic trainer, period, for all of us, what do we need to be worried about and focused on? The other thing I'm going to say, which I don't know if I should out loud on record, but I'm going to. I think that also there are too many people who have been too quiet about their displeasure with the NATA. And at times the NATA just didn't listen. And this is what has also happened. Like, there's been some hard times for them lately financially. And I don't like seeing it at all. But generations have changed. And like I'm the older generation, I'm Gen X. I was always taught in school, it was hammered into us practically, for lack of a better word, to join the NATA, to get involved, to do service, to help, to push things forward. And I think that younger generations, which I have to say I'm kind of proud of, are expecting more than just being told to do things and to help. I also think that we have a lot of people that do and volunteer in the NATA over and over and over. And some of these people need to get out and leave these committees and leave these leadership positions and let some of the younger people in, because that's part of their problem. They recycle leadership all over the place. But my point is that people see that and they get frustrated. So you either do a couple of things, right? You either do something about it if you have the means and the effort and everything, which not everybody does, or you continue to pay your dues and be quiet, or you leave and you just decide that, I'm not going to pay anymore because you're not listening to me. I can't get any volunteer opportunities. This person's already in the Hall of Fame. They've already been on this committee. They've been leading this committee. Why are they in charge again? Like, where are the leadership opportunities for the younger people? And I am not talking about me, because I know my time at NATA is over. But like, for younger people like me, and for even younger people than me, like, where are some of these bigger leadership opportunities? The other thing you have right now is, I think because of some of that, is that people do not, there's a lot of volunteer fatigue. So anyway, sorry, I didn't mean to go off. I didn't mean to, but it's been a complex problem in education for me, since the leadership that they've chose to do the ECE, to run the ECE after Sarah Brown, has been a rocky road, and to watch it has been frustrating. And they have some people in there now who are actually educators, but for a while they had people who weren't. And it's like, well, you either do something or don't. But I think the people who were like, I'm not going to do anything about this, and I'm just going to leave and whatever. So.
Yeah. Well, I think that's the point of this show, is to kind of create these conversations to show where our weaknesses or strengths are within the profession. And I think it's also addressing some of the misconceptions that are happening ultimately. I think a lot of people we're not talking about Katie, but they actually don't really know how Katie works and how the standards are put out. It's up to the program to implement the standards or guidelines. So it's a lot of finger pointing, and it's really trying to talk it out and figure out, well, what are the next steps? How do we address this? Where is the dissatisfaction coming from? I think there's just a lot of confusion, and it's trying to straighten it out ultimately and figure out what the next steps are.
You work hard. You train hard. You take care of everyone else. But when was the last time you treated yourself? That's where Soar Soap comes in. Created by athletes for athletes, Soar Soap is an all-natural recovery soap that helps wash away soreness, inflammation, and fatigue. With ingredients like peppermint, eucalyptus, and activated charcoal, it's basically self-care disguised as a shower. Whether it's after a long training session, a tournament weekend, or just a tough day, Soar Soap helps you reset, recover, and smell amazing. Because taking care of your body shouldn't stop when you leave the gym. So go ahead, treat yourself. Head to soursoap.com and use the code TTB15. That's TTB15 for 15% off your order. Because recovery starts with you.
Hey listeners, ever find yourself on the sidelines needing that one crucial item? Look no further than Nexus Sports Medicine. Nexus is your go-to partner for creating comprehensive medical kits and accessories tailored for athletic trainers in any setting. From high school fields to professional arenas, Nexus has you covered. These kits are designed by an athletic trainer with meticulous organization, ensuring that you're always prepared, no matter the situation. Stay ahead of the game with Nexus Sports Medicine and keep your athletes safe and thriving. Check out Nexus Sports Medicine at nexus-sportsmed.com. That's Nexus, Nexus-sports, SPORTSMED.com to find out more and get your perfect gear today.
I think you hit it on the head with how the NATA is structured right now. They keep pushing that they're trying to be transparent, yet a lot of those pathways get shut down quickly. Even with my podcast, when AJ Duffy was elected and they were looking for the new director position, I wanted to have him on to talk about what leadership means to the NATA, how they're defining it, what are the standards or expectations of this position. And ultimately I got turned down by public relations. They didn't understand or like what the questions I had provided. I try to be very compliant with them on, I'll let you guys have final say. I'll edit it the way you need it. And, once I started kind of trying to push it along, it got shut down ultimately. And now I see AJ on all these other podcasts except mine. So it's just very confusing that they keep pushing a message and they're not following through.
Yeah, I've said it numerous times that I feel like they sometimes can't get out of their own way. And the one thing I'll say is, I don't know if you've heard the phrase AT nice.
Nope.
You ever heard that phrase? It's a common phrase amongst a group of us. One of the things about athletic training, and again, some may not like hearing this, but this was a male predominantly, a male. When we started out, everybody was a male.
Yeah.
And most people were males. So, but you look at the demographics now and it's 50-50. And but still there's, we're still so young. It's not quite caught up as much as you would think. And we tend to be too nice to each other and not have any frank conversations in public or frank type things like this, where people are okay saying that they disagree. A lot of times, if you do disagree with something of the NATA very publicly or do something, it's not very well received. And I think that they would, this is just my opinion, but I think they would be in a better place today if they at times had said they screwed things up, or said, they were sorry, or did some of the things that they said they were going to do. Like some of the recycled leadership and some of the people that have been appointed in some of the really big positions all come down to who they know and their friends or something like that, it feels like. And I don't really mean this recently, because they did the whole thing now where if you can, most of the appointees are done by district directors and things like that. So that did change things a little bit, but I don't know. I don't think it's all AT nice to me. It's like, can we just, even if we disagree and have a conversation about it, can we disagree with each other and just talk about it and have a conversation and it not turn into a heated debate? Like, if people don't want, we had a president a few years ago who blasted people on Twitter because they weren't NATA members. Tell me how that's going to help. Help me understand how it's going to help to put someone on blast after some of the things that, anyway, it's not helpful.
Yeah.
And so there's either this like AT nice where you don't say anything at all, or this public, almost like blasting of people who are just trying to live their lives and do their jobs. And just because they're not an NATA member for a year doesn't make them a bad human. Like, maybe they don't have the money.
Yeah. Yeah. And I think as I've been doing the podcast, I am trying to cover more Domain 5 things, but I think that's where, professional responsibility specifically, not administrative. I don't care about that. It's still important. But I don't think that we're hitting it hard enough in our programming on how to execute these soft skills of leadership. And I think it's becoming a vicious cycle of when you come out of the education system, I'd say, I don't have specific numbers, I'd say 50% of the time you're going to have to go out and work by yourself right out of school. If it's a high school or that only has one athletic trainer, you're doing a lot of per diem. And that movement from being a student or subservient and then coming into a position where you have to make decisions, and you're leading your athletes, your coaches, but you're not really in that professional realm of working with other athletic trainers. And I think we get decision fatigue. We have a lot of conflict resolution type of situations, and we don't get those areas of just a regular conversation where somebody's trying to listen and work with you to come to a resolution that's supposed to help everybody. It's a lot of negotiation. It's a lot of trying to hold your ground. So we become very combative with just within our profession of, this is what I need right now. I don't care what everybody else thinks. I need it. And there's no opening to, well, have you thought about these different things? It comes off very threatening when you're not coming in prepared, or that's my impression of it ultimately. There's a lot of ego as an athletic trainer, and we're very independent, which is great, but it kills us when we're trying to progress a whole group that are like-minded and trying to get to the same thing.
Mm-hmm. Yeah, it's a very strange phenomenon that's happened. Like, and from what I hear from other people, it happens in every profession. But I feel like there for a while we had a lot of people, statistically speaking, were members of NATA more so than a lot of other national organizations. And over time, and maybe this is just part of our development as ATs, that we kind of do splinter off and do some of these things. But it kind of, at least as far as I'm concerned, from what it used to look like, it's a little sad to see. But
yeah.
So.
Well, and I think it's with athletic trainers leaving the membership pool of NATA, I think it's a sign that they need to work on refocusing what they're trying to do. Looking at the strategic plan that we're currently in, it's very broad. And from what I learned, you need to have measurable timelines and things that you are actually going to accomplish. And I don't feel that that is being articulated in our strategic plan going forward. And it's very difficult for me as an athletic trainer to contribute or ask questions when it's such a broad painted brush. And I know you're covering a lot of people and things, but I think within the organization, they can put better key performance indicators to make sure that they're satisfying their membership base. And that's where I've kind of lost sight. I know there's a lot of debate online right now since renewals are coming up in the next month or so. And it's just very interesting reading and listening. People have just really backed away because they just don't understand, and they don't have good enough marketing to be able to sell our athletic trainers on why they should be a member. I'm not sure that they have good enough marketing to be able to cater to other stakeholders that aren't actually athletic trainers. And that's my interpretation of it.
Yeah, I think that for a lot of people, the younger generations want to see outcomes, and there's nothing wrong with that. The people that we have, our members at times will challenge us a little bit and say, well, what am I getting for this membership? And we've put in a lot of resources to really amp up and show that. And I get it. When you're as big as the NATA, sometimes I, Stacy Walker, may not see many like day-to-day any kind of big outcome from the NATA that helps me. But if they can make some headway with some lobbyists and do some different things, there was the Army decided
the H2F.
And then that was reversed, and I'm sure the NATA had a big hand in that. So that was, and I'm happy to see that. I don't work in that setting, but I'm glad that my dues went to pay to have that happen, because we don't want that. That is an outcome we need for the overall profession, regardless of where you work. And I think that for a while, there was the hope that people would just continue to be NATA members to continue to be NATA members. And I think we've reached a bit of a tipping point where people are really starting to ask. Well, not just recently, but I think COVID was really a bit of a tipping point for people too, because, it was just financially hard for some athletic trainers during that time. And the reaction from the NATA after some of that was really kind of heartbreaking. Not to be all dramatic, but the some of the things that and I know they tried to course correct and do some things, but the past president who went on blast and blasted people for not being members, I don't think that was handled right. That person is still embraced by the NATA, and they shouldn't be. Like, they should have been called out on it. But we don't do that. We're AT nice. That's a former president. We can't do that. Well, yeah, you can. If I go on Twitter in 10 years and blast people for not being AATE members, somebody better call me out. And that's the thing. Like, hold some of these people accountable. Like, hold yourself accountable. Anyway, so.
Yeah. So when putting together the AATE, so the mission is to keep nimble and quick. How do you guys do that without making rash decisions? What is your checks and balances ultimately?
Sure. No, that's a good question. We've been, we're still growing. We have now, I think, 5 board members. And the founders have all wrote off the board except for me. Well, one had to leave because he works for the Katie, but and how do we do that without making a rash decision? We're strategic on we have very open and had very open conversations from the beginning of and two of the things we usually talk about are what are the advantages to doing this and what are the unintended consequences. Andy Winterstein used to bring that up all the time, and I thought it was a really good way to say it, right? What is going to happen if we do this that we're not thinking about, that might happen? That could be something that might not be seen as a positive by some. And so we had those conversations about that. The other thing is if we try something and it doesn't work, we just don't do it again, or we try to course correct. And so that's the advantage of being big. I will tell you that as we have grown, we've had to, at first we didn't have any kind of administrative help. Then we did hire an executive director for a short time, and now we work with a management group. And all of those things have led to us having to implement more policy and thinking about things, as we've that have at times not slowed us down a lot by any means, but there are times when I've thought to myself, well, this is how, what's that sweet spot of where we get too big, where we can't make a rash decision quickly, right? Where we don't have the ability to put a statement out quickly without having to run it through people or do something, like if something happens. Which I know that DEI is very controversial right now, but when it wasn't, one of the things we did is we got together and put out a statement on DEI as fast as we could. We've put out a couple of statements like that, and so, but I'm sorry, I'm kind of trailing off, but we go back and forth, and I know that I like it when people will tell me they disagree with me, or well, I don't think that's a good idea. Like, that's one of the things we've done as a board pretty well and continue to do is if somebody brings something up, we don't just do it because somebody brought it up. And I'm not saying we've done everything perfect, so that's not what I'm saying. But I mean that if somebody has an idea, and as we talk about it, we realize that it might not work out, we don't just proceed with it because somebody brought it up and we respect, we respect that person. I don't want to hurt their feelings, all these things. It isn't about us. It's about the AATE. And is this a good thing for the AATE? And if it's not, then we shouldn't do it. Or if it is, but we need to wait strategically or do something like that, then we. But I will tell you that as we've gotten bigger and time has evolved, we've started to have more robust conversations about, is this a good idea or not? Is this something that we can do? So the symposium was a little risky, was one of the things that, we talked probably for a whole year before, and then the opportunity came and we couldn't pass it up. But having an in-person meeting was it's a huge investment of time and resources, and it's very, very risky, because if people don't come, you lose a bunch of money, which we've never made any money off the symposium, and we really don't care if we make money. We would just like to, at very minimum, break even, and we haven't even done that yet, but we're still happy to do it. And I just bring that up as something that we talked about doing, and then we just took the risk. And sometimes you have to take the risk, so it's been great so far. So
good. With the evolution and growth from where you were at in 2018-19 to now, what are the biggest strides you've made? And then for future focus, what are the next few things that need to be implemented to strengthen your guys' organization?
I think our biggest stride, I want to say the symposium, but I don't know if it is. I think our biggest impact has been some of the AATE conversations we've done over time and our response to COVID. We had a pretty good response to COVID. Started getting people on Zoom, had some in Zoom things, and tried to get educators together to talk about it because it was a stressful time. And I think, honestly, not that this is really, I think part of our stride is just that we have continued on and grown in our membership. We're an instant, and so one of the things that we are going to have to weather is, do we stay institutional membership? And right now to join the AATE, it's $2,000 per institution, which is a lot of money.
Okay. Mm-hmm.
I'm not even going to try to deny that's not a lot of money. But the AATE does take a lot, websites, other resources, feed loop, other things and none of us are being paid or anything for that. So we do pay the management company, but none of us, like any of us, are being paid. And so I think the thing that we have to do in the future is figure out how to ride, higher ed isn't a very, we're in a spot right now, higher education, and it's becoming more and more like a business. And so, what is it to a university to pay $2,000 to a whole university? Not much, but to an AT program's budget or a department budget or college budget, they're going to start looking at those things. So I think for the future, we have to determine what kind of membership status we're going to keep. And the other thing is we need to keep trying to get educators together and showing our value, keep the partnerships we have and keep our relationships strong. We have a good relationship with the AATE. We just started up a wonderful relationship with Gopher Ellis. Mm-hmm. We have a great relationship with the Performing Arts Society, with athletic trainers in the physician practice. We have started relationships with public health and some of the other societies, smaller society, the newer, shouldn't say smaller, newer societies and associations. And I think that the band of us together can really help and support each other. And then we have to continue to show our value to our members and what we can do for them, and just to continue to put out resources and things to help drive things forward.
How many institutions or programs are members of the AATE?
Right now, it's I believe it's 50. It's either 50 or 52, 53, something like that. Okay. We are even with where we were last year in terms of members, and we've lost some members due to financial. We've also lost some members because they're not programs anymore. One of the part of the membership is being an actual athletic training program or a residency, and so, and there's been, because of the master's level and because of the state of higher ed, some programs haven't weathered that storm, unfortunately, and so that's in part. But we have 50. It's that low 50s.
Can individuals be members if their institution for some reason doesn't cover it?
Well, at this point, no.
Okay.
So we do have a clause where doctoral students can be members if they would like. And we also have a clause or a membership category where an individual who, if you were part of a program that was a member when we started, you can be an individual member. So, I think that's one of the things we do need to talk about is individual membership and what that would look like versus institutional versus, because I would go out on a limb, and this is just my feeling. Right now we don't have, I'll just stop there. we used to have an educators conference where people got together and we saw each other and people presented and talked and everything. The Katie used to have an accreditation conference every other year, and those have all stopped for various reasons, and which is part of the reason we wanted to do a symposium, because there's no way to get us together. So
Yeah.
But I also don't know, from what I'm hearing in the landscape of higher ed, some of that professional development money is starting to dry up for people. So I think that's the other thing we have to figure out is the AATE, is how can we still, because you mentioned a Zoom or a virtual conference, and some people are like, I don't want to do that. But at the same time, when you say, well, let's do an in-person, well, I can't come to that. And so, and I see both sides of it, right? I mean, I get it, because the it's like, well, but there's got to be some way to help engage and help our members both build community and feel supported and feel not as off on an island that hopefully some of them don't feel. So
Yeah. So it's all for basically the master's program, correct? Or are PhD or DAT programs included in this organization?
They are, yeah. Any DAT program and any residency can be be a member. So
with the evolution, I mean, I've heard that a lot of high school programs are starting to, well, not disappear. I guess the college undergrad programs for sports medicine are starting to disappear. Would you guys ever think of including those types of educators into your program at the high school level or even the collegiate level or undergrad level?
Absolutely. It's a great question. We haven't really had that conversation. I didn't realize, are some of the sports medicine programs are disappearing, like the majors?
I think the undergrad ones, from what I've heard through the weeds, is that the Katie's kind of trying to squeeze those because it's taking away from the master's programs with, the student athletic or the work study when you're in an undergrad. Usually there's some students that are going in, getting hours, working, making some money. It sounds like that's getting kind of squeezed at the moment. I don't know how true that is, but they think that those students that aren't in a program or even certified, whatever you want to define it as, it's taking away from our credibility as certified athletic trainers due to some of these services that they're providing. But that's what I've heard ultimately. So I think some of those sports medicine courses, or even just the clubs, if you want to call it that, are starting to get squeezed out.
Can I make a comment on that? Would you mind?
No, you're totally fine.
So it's a slippery slope there, because I'm fully supportive of some of the, some places when when the institution decides that where it's just not feasible for whatever reason to have an athletic training program anymore. For a lot of them, or at least a handful of them that I'm aware of, that I can kind of remember, they've decided to keep the faculty there. Or if the faculty wanted to stay there, they could, and they could teach other courses. And so some places have started kind of pre-athletic training programs, right? Which I actually am an advocate for. I think the challenge becomes when those students are almost used like athletic training students. That it can be a challenge, and that the Katie might frown upon that just because of, if I've got a sophomore or a fresh junior or senior who is an intern athletic training student or whatever you want to call them, and they're setting up people on modalities and doing some of the skills that we do as athletic trainers or athletic training, like students in master's programs, it could send the wrong message to the patients. Could violate practice acts and things like that. So I don't know. I don't think the Katie has the bandwidth to shut those programs down, but I don't know exactly how the Katie would be involved in that, but I do think that there's a fine line of like running one of those programs what's really good and sets people up for huge success in the master's programs, and also could also make us look a little bad, if you know what I mean, like to have interns doing things that students might do. I think the thing that some of these places, not for nothing, but reach out to some master's programs and see if you can get AT students, because they need that hands-on. Like, you still have to have a preceptor and have a supervisor, but yeah. Anyway, sorry. And you don't have to put that out into the ether. I just wanted to comment because it's a slippery slope. I've seen some of those programs, places where they've just basically there's a upper extremity injury evaluation course in the undergraduate level, and it's like, like what are we doing here? So.
Yeah. Well, and I think it's just the marketing point of view is we have a gap of 4 years now. It sounds like a lot of those student athletic training students, student athletic trainers, I always get confused what order that is, but it's being around it, creating interest, marketing, going into the masters. And I feel if we start squeezing those areas, we're going to lose I think the high schools have done a great job of promoting athletic training and the education. But now that we don't have this bachelor's route anymore, there's a 4-year gap. And are we going to lose a lot of athletic trainers to different professions, which we already did before? But how do you keep somebody interested and involved and getting light reps or understanding of how athletic training actually works? So I think I'm a fan of trying to keep that undergrad area. I mean, I was a work study student, and it definitely reinforced that, this is what I want to do. Even though it was very basic, I was not making any calls, but it was just being almost an aide. I mean, there's physical therapy aides, which I think athletic trainers go into because some clinics just don't accept them, and that's their route to private care or private practice to an extent. So it seems that I can understand enhancing standards for the experience, but at the same time, it seems like it's getting very narrow. And I could see it as a difficulty of maintaining those 4 years of interest and getting people to actually go into the master's program. But I don't have any data to back that up at all.
I actually completely agree with you. We've got momentum, right? You have a high school student who really thinks athletic training is awesome, so they go to undergrad. And if that momentum isn't there, they could end up in a different field. And some of those places who are offering some of those opportunities, I actually think it's an excellent opportunity. I think it's just tricky and a slippery. You know what I mean? Like, yeah. Not putting them in positions where they're doing too much, but also putting them in positions where they can do some things and see some skills and have some fun and get a sense for what we do as athletic trainers.
Yeah.
So.
In sports medicine, we talk a lot about recovery, but not all recovery tools are created equal. Mark Pro isn't just another muscle stim unit. It's a recovery technology trusted by elite athletes, athletic trainers, and rehab professionals. Whether you're grinding through tournaments, back-to-back practices, or long clinic days, Mark Pro helps your muscles recover faster, perform better, and feel fresher tomorrow. By improving muscle activation and promoting natural circulation, Mark Pro clears out fatigue and accelerates your body's natural healing without soreness or downtime. Use Mark Pro to stay ahead of fatigue and keep performance consistent, because in sports medicine, recovery is performance. Head to markpro.com and use the code TOTHEBONE for an exclusive listener discount. That's To The Bone at markpro.com. Mark Pro, the best in recovery.
Now, more than ever, athletic trainers are becoming inundated with the growing volumes and sources of data surrounding clinical injury management. In fact, the purpose of data has changed. Whether it's pre-participation examinations, electronic medical records, concussion management, nutrition, or wearable devices, athletic trainers are constantly faced with new and complicated challenges interpreting data to drive patient care outcomes, reduce injury rates, and show practitioner value. To get ahead of this change, athletic training departments turn to Preventix, a data analytics solution provider. With over 25 years of athletic training and clinical data experience, Preventix empowers athletic training and sports medicine organizations with tools necessary to quantify the impact of care interventions on patient success and outcomes. As a trusted partner, Preventix works with you to build a strategy that addresses your specific pain points, integrating all your data sources, providing clean, reliable data, dashboards, and metrics that can be immediately accessed by stakeholders at the point of care. Don't let messy, siloed data continue to negatively impact your care delivery initiatives and practitioner value. Unlock the power of your clinical data today. Visit Preventix.com for more information. Preventix.com. So going back to AATE, what are the responsibilities, or what type of responsibilities does a professional organization hold towards its members?
Can you repeat that? Sorry.
No, you're good. As an organization, what is your duty to in providing information or resources to your members look like? What is your guys' responsibility as a formal organization?
Mm-hmm. I think we try to anticipate the needs and what educators we think they want and need, and provide different types of resources through our website, through some of the AATE conversations that we do, through the symposium, through some of the advocating that we do. We've had some virtual fairs where we're trying to get either high school or college students who are interested in athletic training come, and they can talk to different educators at that time. And yeah, I think we have a duty to provide services for the membership that we ask for, right?
Mm-hmm.
And to provide things. We can't, just like any organization, we can't be everything to each individual member, but we have a responsibility and should be held accountable to provide things that resources and educational endeavors and other things to our members. We have a few working groups and different groups that are, we just had a pharmacology resource that was provided, and we've done some things around diversity, equity, and inclusion. And so I think our overall, because I don't want to get it caught up in trying to list everything, our overall is to try to meet the needs and the changing needs of our members, and kind of read the room, right? Read the room of what's going on in education, read the room of what people might be interested in, and that kind of thing. When we do the symposium, sometimes that gives us an idea of what, some of the topics that we have this year. One of them is remediation, which I don't think we had a lot of when we were at the master's level, but now that we're at the graduate level and the way the CATIE standards are laid out, that, there are certain educational standards that we have to meet, period. Mm-hmm. And if we don't meet them, we have to provide, if the student doesn't meet that challenge, we have to remediate. It's no longer, well, you just got a 60 on that exam or that assignment, that's too bad. It's, well, you didn't meet the standards, so now we must remediate you in order to make sure that you have the skills and the knowledge that you need in order to, graduate from this program, pass the BOC, and go on. So trying to read the room and meet the needs of our educators and providing resources for them And when we're at the symposium doing a lot, that's why I like the in-person stuff too, because you have some of those conversations with people about like what's really going on with them and what do they need and what do they think is important, and what one of the sessions we think we're going to have basically is we are going to have is how are you doing, and how are you doing in higher ed? And we want to be really careful to not turn it into a venting session, but just back to your question, just being cognizant that we have an organization that is taking money for our membership, and we have a duty to provide resources to our members and things to show what is the membership, like why are you a member, and here's why you should be a member, here's what we offer, and for you, what else can we do for you.
Mm-hmm. How has participating in a specialty organization changed your own view of professional responsibility within athletic training?
I don't, honestly, I don't know if it changed it that much. And just in terms of doing service, I was raised, and it was always kind of instilled in me to do service in the profession. Even from my undergrad, I went to SIU Carbondale, and they really instilled that in us. And honestly, when I got into grad school, I mean, you're in grad school, what are you going to do? You're in grad school. Like, you can't, and I'm always amazed by some of the graduate students at any level that are heavily involved in, the organization, or they're doing student committees or anything like that, because I can't imagine trying to do that. But once I got out into the profession, I really tried to volunteer for things and put myself out there. And I think that, that's a great question, and I didn't think much about it. But I think the thing that's changed in me, honestly, is for me to understand that not everybody's like me. I think there probably was a time where I would get a little frustrated with people who didn't serve or would complain and didn't volunteer.
Mm-hmm.
And it's like, if you're just going to keep complaining, either do something or shut up, and I have a little more grace for that now. Partially because I see some of those opportunities drying up and not everybody gets to volunteer like they want to. And also just the world is different. I mean, we're being pulled in thousands of different ways. And, sometimes people don't have the ability to serve when they want to. And to have a little better of an understanding that there might be times when people don't have the ability to serve, but that doesn't mean they're not engaged and they don't care. And so that's one of the things, as I kind of really reflect back, that we took into account with the AATE, is that, you don't have to serve on a 3-year committee. If we want to produce something on, we put out some resources on mental health. We had a group of people who put that together, and when they were done, they were done. Mm-hmm. And so you're not sitting on a committee once a month in a meeting, just because you're on the committee, and the committee's supposed to have a call once a month, but the person doesn't put an agenda together, so you don't even know what's going on. And so being very respectful of that mindset of, if I'm going to volunteer and serve, I want to do something meaningful. And that people who don't do that at times, it doesn't mean that they don't want to. It means that they just might not have the capacity for it right now, and that they might in the future. So I've given other people more grace and had a better understanding of just service and volunteerism. And that I think sometimes too, when people are angry about not being able to volunteer or not having opportunities, and then decide not to for a while, that's okay. Come back. Give yourself some time. Be mad. That's okay. It's okay to be mad, and come come back. And I think that's the biggest thing that it's changed me, because, building this association has taken a significant amount of my time, has totally grinded some of my research to a halt and other things, but I chose that. And that's the choice I made. But that doesn't mean that that choice is right for everyone. And that also doesn't mean that everyone has the same level of and capacity to do services I do. So,
Yeah. Well, we covered a wide variety of things. Did we miss anything specifically about AATE that you would like the public to know about? Any initiatives that you guys are currently working on? Anything to sell people to be part of this organization?
right. Gosh, we are continuing to have discussions about membership. I know that people have asked us about individual membership, and we're continuing to have that discussion. Some of it comes down to financials.
Mm-hmm.
I will say that one piece that is a bit of a sore spot for me at times is when, and I get it. I don't know if it takes a lot to run an association like this. It takes a lot of people, it takes a lot of resources and money. And, when this started, my husband and I put money in to get this started because there was no money. I mean, the four of us put money into this to start it, and not just like $200 or something. Like, we put money in. And then as the association became financially viable, we got that money back. But and don't get me wrong, not everybody has the ability to do that. So I also feel really fortunate. I mean, that was part of how we came about. I mean, that's how a lot of associations start up, is either through, that's how the NATA was floated by Kramer for many years, right? It would be if it weren't for Kramer. So the money has to come from somewhere, and I was happy to do that. I think that I would so let me two things. One, if we could do this for free, we would.
Mm-hmm.
Let me just put it that way. If there was some way where we could have funding, where people could join and just give a little bit of money, and this would all float itself, I would still do it. But it takes money to do it. And so, so we are looking at options at individual membership versus institutional membership, and what that means. I had a thought and I lost it. It was a good one too. I'm like, oh, that would be really good to say to people and I think the other, I know what it is. We are not, I think that some people at times feel that we are elitist. I've heard that from people, that other people have said we're an elitist group. I wish people could come and spend the day with me and see what my life consists of. I'm no elitist, trust me. We just wanted to start this organization. We came up with the $2,000 membership because it was enough to get us started. If we went with individual membership, we did the math and we couldn't make it work.
Yeah.
So for us at least, and all the other places were institutional membership. So we modeled it after that. But the other thing is that, give us a chance. Go on our website. We're about to redo our website, which is a big breath of fresh air, because our website had grown into this clunky mess of things where we added things on, and then it just was like, this isn't viable. Our website's had its challenges at times where people have gotten upset with us, and it's like, look, we know, but you can't change a website that quickly. Like, you just can't, or at least we can't. We don't have that kind of money.
Yeah.
So our website is getting an overhaul. We have the symposium coming up, and would love to have people come to it, whether you're a member or not. We don't care. we have some exciting stuff with Gopher Ellis that's going to be coming out. We're going to have we're having a student. We're partnering with the Katie and ATPPS and the Performing Arts Society at the symposium to do a student day where students in the area who are interested in athletic training can come in and talk to different athletic trainers from the different settings. And so we're doing that. And we have, we're looking at strategic planning. We've got the research network going. We're hopefully going to have some research getting started with them. And we have a foundation now that will fund research, and we're looking into what other things we can do with that foundation to help fund, because we want to fund educational research. So, give us a look. Go onto the website. If you want to find out more about us, talk to one of us. Talk to me. Talk to Jen Volberding, the current president. We're just regular people just trying to move the profession forward. And I know it sounds really cheesy, but that's really all it is. We just wanted to start a group that was really focused on educators and could really focus on, okay, what do you need versus what does the profession of athletic training need? Was how we all got started. So
yeah.
Well,
that's so cool. And you guys have grown relatively big in 7-ish years. So I think you guys are on a good track.
We'd like to get more. We'd like to get bigger and have a bigger voice for educators, and we're trying to figure out how to do that and be a financially stable.
Yeah, I bet so. So we can find you at AATED.org if you want to look up more information.
Correct.
Awesome. Well, going forward, if somebody needed to connect, that's the best place. All the emails are on there. Are there ways for people to volunteer and get involved that aren't educators directly?
Sure. If somebody would like to work with the AATE, partner with us, do anything with us, we are open to those kinds of conversations. That's how we've gotten some of these relationships with GoFor and some other places. So yeah, we would love to. And people can reach out to me. My email address is sewalker@bsu.edu. If you just look up Stacy Walker Ball State, you can find me. Pretty easy. But we're on the website, and we're on Twitter. We're on it's still Twitter, by the way. We're on Twitter. We're on Facebook. So yeah.
Perfect. Well, thank you so much for being on. This was an insightful conversation, and I enjoyed it. Talked about a lot of things that are being talked about in the shadows, and they're important things.
They are. I really appreciate it, Shelby.
Yeah. Well, I hope to have you on in the future, and we can talk more about specific initiatives if you are ever up for it.
We would love to. We would love to.
Perfect.
Thank you so much.
That's it for today's episode of To The Bone. I hope we've sparked some new thoughts, challenged your perspectives, or simply reminded you to dig a little deeper. Remember, life isn't just about what's on the surface. Sometimes you've got to cut deeper and get to the bone of what really matters. To The Bone podcast is a product of Daly LLC. It's hosted and produced by Shelby Daly, ATC, and Randy Daly. No clinical decision-making should be based solely on one source. While care is taken to ensure accuracy, factual errors can be present. For more on the show, visit www.tothebonepodcast.com. If you enjoyed this episode, be sure to subscribe, rate, and leave a review. Get involved in the conversation. You can find us at www.tothebonepodcast.com. Drop us topic suggestions or be a potential guest. We're all about connecting with you, our listeners. Until next time, stay curious, stay grounded, and keep cutting deep.